Madam Chair, we are ready whenever you are.
The time is 10:41 on May 9th, and I'd like to call to order the Business and Governance Committee meeting. Rosie, do we have a quorum?
Yes, Madam Chair, we do have a quorum with the following member absent, Mr. Paul Kaufman.
And we miss him.
Yes, we do.
Rosie, do we have any public comment?
No, Madam Chair, we do not have any public comment for today's meeting.
Okay. Before we move on, I also would like to recognize and thank Alvin for his service to the Business and Governance Committee. You're planning on leaving our board following the May meetings, or is it this meeting? Yeah, this meeting, and we hope that you will consider returning to SDCERS. I personally have appreciated having you on our committee. I like the way you ask questions. You're not threatening, you're just inquisitive, and you have very, very good insight. So please consider, when you've finished all of your family responsibilities and educational requirements, that you would come back. Okay, moving on. Rosie, no, we have no public comment. Moving on to section 4. We have 6 action items on today's agenda. The first action item is staff's recommendation to approve the annual cost of living adjustment effective July 1st, 2024. And Sandra.
Yes, good
There
morning.
we
This
go.
is a fun one. Everyone likes this one.
Yep.
Each of our 3 plan documents provide for an annual cost of living adjustment, not to exceed 2%. And that needs to be calculated and approved by the board to be effective July 1. This year, Chiron has calculated the consumer price index change to be 3.4%. So members will be credited with their full 2% COLA effective July 1, and then their COLA banks will be credited with 1.4% to be used in future years if that number does not reach the 2% minimum. And if there are any questions, Greg is here to answer them.
Bobby, I have a question. Every year for the last 3, 4, 5 years, we've always had surplus beyond that 2%. Where did we come up with that 2%? I forgot.
It's in the plan documents.
Okay, so that would be another city council kind of scenario where that's what they programmed. And how many years ago was that programmed into the plan document?
That's original language.
I would say many.
Yes,
Yeah,
yeah, that's
we'd have to go
original
back
plan
and look at
document
the-
language.
And do we see other agencies throughout California that are above that percentage?
So I can speak from experience in looking at the 1937 Act, what Chris had alluded to before, the 20 county retirement systems. They are currently at a 2% maximum.
Okay.
There are some historical tiers that were up to a 3% maximum, but those plans were closed many years ago. But there are various cost of living arrangements that match the CPI, but not in our California pension community.
And so is it safe to say in 1981, when it was 2.4%, was that the max for those retirees? And then it was changed to 2% after 1981?
So
Or what's the difference there?
there's 2 people that this applies to, the 1981 rules. And there is a different formula for calculating what is their COLA rate.
Got it.
Tied to a San Diego rate, believe it or not.
And there's only 2
There's
people
only
left
2
in that plan?
left in that plan.
Thank you for the answers.
And I believe SDCERS, the teacher's pension, has a 2% cap, right? May I have a motion and a second? And we voted.
With all votes in, Madam Chair, this motion passes 5-0.
Thank you.
Thank you. Thank you, Sandra. Moving to number 2, staff's recommendation to determine and certify that the Port District's proposed miscellaneous member benefit changes comply with the Government Code Section 7522.02 of PEPRA. And Johnny, will you please introduce this action?
Of course. Good morning, Bobby. The Port District wants to change its benefits for its miscellaneous members. Those are miscellaneous classic and miscellaneous PEPRA. The change is really to end the 5-year waiting period to earn service credit. So these employees, if this proposed plan would pass, would earn service credit within those 5 years and continue on. To change a benefit formula under the Public Employees Pension Reform Act of 2013, or PEPRA, it says a retirement board and its actuary must determine and certify that the change results in a cost equal to or less than the California Government Code standard PEPRA plan. So staff and the port have been working with Chiron, our actuary, and Chiron has studied those changes, which you have in your material, and they have determined that the changes meet PEPRA's requirement. And so based on that determination, staff also recommends that the board find the changes meet PEPRA's requirement. And I want to thank Eric Lawrence, who's here from the Port District, for coming and for helping us along with this process.
Thank you, Johnny. Would any committee member like to speak on this matter?
Yeah, just a couple questions. Yeah. Now we figured out which is which. Yeah, yes. Two things. So PEPRA does not apply to the city, right?
That's correct.
And it applies to the port and the airport, both?
That's correct.
And is the gist of this that the change has to be essentially neutral or something? Is that what they had to do?
The gist of what this law concerns is that the state wanted to mandate a specific formula for new employees. They didn't want higher pensions for future employees. And so they said, this is a formula that all new state, some county employees will receive, and that also falls to airport and port employees as well. But there is an exception to that, which is if the current plan is equal to or less than that standard formula, then your agency can keep that formula. That happened with the miscellaneous plan here. And so if they wanted to change that formula, which is where we are now, the PEPRA says, well, we still got to meet that threshold. And so Chiron has found that they do meet that threshold and that the port is welcome to then propose that legislation in compliance with PEPRA.
Thank you.
All right.
Johnny, if this gets approved today and tomorrow, when would it take effect? And is it for future employees only?
Sure, good question. Thank you. And so if this passes today and then the board votes on it tomorrow, then we would give that information to the Port District, and the Port District could work with the state legislature to get it approved the way it needs to. And my understanding is they're looking for this summer to have that passed. And if it does pass, it affects these miscellaneous members. So these members that initially hired by the Port District from 2009 to 2023. Did I get that right, Eric? Okay.
Good morning. My name is Eric Lawrence. I am a manager of people services with the Port of San Diego. Thank you for your consideration of this item today. Under PEPRA, the change to the plan, once it's certified as lower cost and lower risk than the standard PEPRA formula, has to be approved by the state legislature as a matter of state law. So there actually is a bill pending in the state Senate right now, sponsored by Senator Padilla, and that's currently in committee. Should the SDCERS board certify the report tomorrow, it will be moved to the state Senate for a full vote of the Senate, and then it will move to the Assembly for their committee and approval process. So we don't have an exact effective date of when a change will be implemented. It would be dependent on when it gets through the legislative process, probably later this year.
And as Johnny mentioned, it would be retro to the 2009 participants that were hired and beyond?
It would not be retroactive. The change would be prospective as of a given effective date, but it would apply prospectively to existing employees who are in the plan.
Got it, thank you.
Thank you.
Thank you.
May I have a motion and a second? And let's vote.
With all votes in, this motion passes 5-0, Madam Chair.
Great, thank you. Going to number 3, staff's recommendation to approve a contract amendment with Sagitech Solutions Support Agreement. Michelle?
Good morning. A little background on this action item. In 2011, SDCERS selected Sagitech Solutions through a competitive RFP process to implement a new pension administration system. It was a 36-month project, and in 2014, the system known as IRIS went into production. This will explain why my kids have a 3-year age gap, that project. Since going live in 2014, SDCERS has maintained an outsourced support model with Sagitech. The support agreement includes application licensing, application development, and disaster recovery services. We've continuously contracted our support agreements in 5-year increments since 2014, and we're now in year 5 of our current contract. Staff is pleased with the services and support model that we're currently working with Sagitech and happy with our partnership with that organization. When approving this recommendation, I want to make you aware that we're waiving 2 board contracting policies. The first is related to the terms. Our policy limits contract terms to a 3-year term with 2 1-year extensions, and this contract is proposed as a 5-year period. The second policy is the requirement for an RFP or a request for proposal on any contract exceeding $100,000. And we're asking these to be waived so we can sole source the IRIS support to Sagitech Solution, as they are the software license grantor and have been providing application support services to our production environment and disaster recovery for now 10 years. So in conclusion, staff recommends the board approve this action item to extend the existing Sagitech support agreement for another 5 years that covers licensing, development, disaster recovery for the IRIS system, not to exceed $3.3 million for the next 5 years.
Thank you. Would any committee member like to speak on this matter? Wonderful. Rosie, do I have a motion? Oh, I'm sorry. I need a motion and a second.
We have Paul Lotz as the mover, and the second motion, or seconded by Elvin Lai. I apologize.
We have a
And we're
motion.
ready for a vote.
Let's vote.
And with all votes in, this motion passes 5-0, Madam Chair.
Thank you.
Number 4, staff and brokers' recommendation to purchase cyber insurance.
Good morning. Staff is I'm very excited that staff has found a cyber insurance policy that provides reasonable coverage at a reasonable premium. And so we have a recommendation today to purchase such. Real quick, I want to give you a little background on our purchase of cyber insurance. Prior to 2018, SDCERS did not have cyber insurance. Essentially, we're self-insured for it. And around 2018, public entities started becoming targets of cyber breaches, and such that we went to the market and found some cyber insurance to help with our coverage in case of a possible breach. And at the time, the insurance market was very favorable to us. We paid at the time $26,000 to receive $5 million in cyber coverage, really over-insuring us for an incident. That premium price was corrected in 2021 when the insurance market became really not, in my opinion, an insurance market. We started receiving bids for premium amounts with such low coverage and high deductibles that it really wouldn't cover anything. So we wouldn't be really purchasing insurance. We would just be paying insurance premiums. But since 2021, what we have been doing is really looking at self-insuring, looking us internally to make sure we would be ready for a cyber breach or something. And I honestly think that has been a great exercise for us to make sure we have people on call, what happens in case of a breach. But since then, we have continuously asked our broker to test the market to see where we are, because insurance is something that could be prudent at the right price. And I'm happy to hear today to say I think we found a right price. And so what you see here is what the broker has found from the market and going to different insurers and what we think is the best coverage for us. Right now, we're looking at a premium of $73,000 a year for the year. $73,000 for a year for $3 million in coverage. First party losses, so losses that SDCERS would incur in order to remedy a breach. $3 million in coverage total include third party liabilities. So if we were sued, had outside costs because of a breach. And this policy even covers assistance with our cybersecurity. And I'm really, really excited about that. I've been working very closely with Michelle Wagner-Malecki, who you just spoke with, and she's just been an excellent partner in continually wanting to improve the program. Just been really excited that she was excited to see that there was yet another wonderful resource to help her with her existing great program. The retention or the deductible is $25,000. This amount, $3 million coverage, is expected to cover over 90% of the losses that an entity like us would incur, likely, and so it is quite adequate coverage. And with that, staff and the broker recommend SDCERS purchase a $3 million cyber insurance policy at a cost not to exceed $75,000. I'll take any questions, Bobby.
Any questions?
Johnny, do we have a sense of what lawsuits along these lines go for? In other words, big picture, is $3 million really adequate coverage for what happens in these major cases?
Yeah, it's a good question, Chris. And working with our broker, the answer is yes. We work with a special team that deals with cyber breaches, and my question is, what amount of coverage do we need? So they ran through all their different scenarios and said this should cover a 90+% of a breach, our company, our size, with the losses expected.
Thank you.
Johnny, what does this actually cover? Is it the cost that the agency will incur to correct it, but not the amount paid to who's ever, like for ransomware?
Sure. Good question. It covers all of that. So it's $3 million of coverage, which would include ransomware issues. It would include maybe if we needed to replace hardware or computerware or software because of the breach, it would help with that cost. It would cover costs to protect our members if some of our members' data was stolen, to make sure that they have adequate monitoring support. It would also cover a lawsuit brought by, let's say, a member who said this was problematic for them.
Would it pay the ransom?
Yes. Up to an amount.
Right. Okay.
I'd like to go on record, we are not paying ransom.
That's right. We agree. But there would likely be costs associated internally, as you say, either replacing equipment or software or what, and the
Yes.
recovery from that. Alvin?
It's more of a comment because you already asked my question, so it's perfect timing. I just want to congratulate you and the team and the broker for finding actual coverage that's actually feasibly in an amount that's stomachable. So congratulations.
Thank you, Alvin.
And I had a question. When would this take effect if provided the approval tomorrow?
Provided the approval tomorrow, it would take effect, I believe, tomorrow. I would need to check that.
But as soon as possible. Right?
Absolutely.
Okay, great. Well, may I have a motion and a second, please? And all votes are in?
All votes are in. With all votes in, this motion passes 5-0.
That's great. All right, moving on. Moving on to proposal for modification of the disability retirement process, number 6. In the previous committee meeting, the disability committee, there was a,
Excuse me, Bobby, can we go to number 5? Did I forget to put in number 5?
no, I have 5.
Okay.
I was just jumping ahead. I had a problem with numbers. Staff's recommendation to amend the board process on selection of the independent non-board members of the audit committee. Rule 5.8, benefits for rehired members and transfers to eligible position. Division 2 of the board rules, contributions, and Division 11 of the board rules, community property. There's no staff presentation on this agenda item. Would any committee member like to speak? Hearing none, may I have a motion and a second? And all the votes are in, I believe. Rosie?
Mr. Battaglia, would you please cast your vote? Thank you. And with all votes in, pardon me, this motion passes 5-0.
All right, thank you. Now moving on to number 6. In the previous committee today, the Disability Committee, there was extensive discussion about this motion. And I believe we have some comment. Do we have comments?
I have no further comment on that matter. I believe Alvin may have a comment.
I have a motion to put forth on this.
right.
My motion is to have staff look at, or even, actually, let me rephrase that because staff is going to look at it anyways. My motion is to mimic or copy SDCERS on their proposal of if workers' comp, if the agency were to deny an employee as incapacitated able to work, that the pension board or the pension system would grant them disability. I understand that that would have to be a planned document change. So I don't know where that kind of goes because the planned document change has to go to city council for changes. Is that correct?
Can you restate that?
So yes, well, let's see. My motion is to have not a requirement. Let me think about this real quick. My motion is to follow SDCERS in the example that was given. If an agency were to conclude that employee cannot work, is incapacitated to work in their current role, that industrial retirement be granted by SDCERS. How we get there is my question. Whether that's a change in the plan document, which is what I'm thinking it is, and if it's a change in the plan document, it would have to go for city council to change.
Alvin, just a point of clarification. It was SDCERS, not SDCERS.
I'm going to be turning to council here pretty quickly, but if I understand you correctly, this brings us back to about 9:35 this morning, where we are looking at the competency of evidence.
Yes.
And relying on the previous workers' comp medical records as sufficient evidence for the board to make a decision. And there was quite a bit of discussion, how do we do that?
Yep.
And I think that was from staff's conversation, was that is a viable business model, but right now, we do not believe that the workers' compensation doctors are providing all the information that this committee needs as evidence to make a determination. And that's the disconnect. And I think our general counsel talked about having a policy in theory versus a policy in practice, and they're disconnected in that. And I think that's from your follow-up question is, how do we bridge that gap?
Yep.
And in our previous conversations, we were looking at that really is a plan design issue. And one is, do we partner with the city and perhaps they can have workers' compensation doctors evaluate that? Can we train them and could they do that? Or two, is there some type of policy change from the plan sponsor where they could integrate the two plans so that we could better streamline and not have anybody fall through the cracks?
So let me go through my string of thought. You're 100% correct, and I'm on board with all of that. My string of thought is Mozzie case, right? And a judge saying her employer won't rehire her and she's not getting her disability, right? So the disconnect and the judge awarding Mozzie, right, in that case. So based on that, and just what I feel is right, and me personally just feeling what is right, is to make sure that the city is on board with that no one should fall through the crack. And I don't think we should change our process. Our process is to administer the plan. I'm not changing our process. I'm not saying that staff is doing incorrect. In fact, I think the opposite. I think staff is doing amazing. But I think it is our job to go to the city, to change their plan document, to make sure that 100% of our employees, of clients for us, are serviced. So that's my motion is, yeah.
So there's the ability for the board or committee to provide direction to staff and saying, staff, we'd like you to go take care of this task. And there's also a way to formally make a motion. At the disability committee meeting, it's staff's understanding that the disability committee provided direction to staff to put together, to research what are the appropriate plan design changes if required to bridge that gap and to bring something back to the disability committee so that the board may formally request the plan sponsor to amend their rules to make sure we take care of all the employees like they're trying to intend with the harmonization of workers' comp and the disability programs. What we had planned to do was to take that opportunity to actually collaborate with the city, various departments within the city, to raise this issue, discuss this issue, and say, how do we work together? How does the city and SDCERS staff work together to craft the ask so that when it's received by the city council or by city management, that they go, yeah, this is a great idea. We think we should move forward and affect the change. I anticipate somebody could probably travel to the East Coast and back by the time staff has the opportunity to get all this work done.
It's only 6,000 miles.
So that is absolutely my recommendation. I just wanted to have a vote here to support staff going and building a partnership with the city of San Diego and figuring out how to close that gap. I would still prefer that this committee, because we missed the opportunity to do that at disability, because we went down a few rabbit holes. So at this committee to say, hey, staff, we entrust you to go to the city of San Diego or whatever agency to figure out how to close the gap and bring something back to disability.
Just a formal board action, yeah, sure.
So that is up to the prerogative of this committee, whether you'd like to formalize that in a vote. I think the staff has already got clear, concise direction. But again, if you'd like to vote, that'd be fine.
Yep.
And does that leave the board rule as is?
It would currently leave the board rule as is. Yes, it would.
All right.
There would be no change in board rule.
So the motion is merely to communicate that the board would like staff to communicate to the city council that these changes, we recommend these changes to be made.
Right. It's staff's current understanding that we would be bringing this proposed communication back to the Disability Committee to make sure that it properly reflects the desire of the Disability Committee. And that's what we'd be doing. We'd not be bringing it back to the Business and Governance. We'd be bringing it back to the Disability Committee, which would then go directly to the board.
I don't know that we need a motion to do that, Alvin. I think we've made it clear, and I believe that the staff, staff understands it, and we will follow up and make sure it gets done.
Sounds great. Then I will
All right.
rescind my motion.
So there's not going to
So
be
there
a
is
motion
no-
to vote on, correct?
Is that,
If number 6 is a motion from me, then I withdraw the motion or whatever, if that helps.
all right. With that, we move on to the reports. Member Services, Victoria.
Good morning. I'm Victoria Fedelizo, the Interim Member Services Director. First and foremost, I like to say that I'm very proud of our call center staff, counselors, and our full-time in-person receptionist. The Member Services team has worked very hard this past couple of months, taking care of our members from answering calls to conducting counseling appointments and handling Prop B3 members. Our call center, with the lead of Andreas Molina as our full-time call center supervisor, congratulations, Molina. I'm sorry, congratulations, Andreas, worked hard to keep the average call wait times down and all other tasks and workflows completed in a timely manner. The average call wait time for the month of April has decreased to half of what it used to be. Staff changes. One of our very talented call center representative, Michelle Mendoza, is moving to the finance division. Michelle started off in the call center as a representative for 6 months. Michelle has a background in real estate and auditing real estate documents. Michelle has been a wonderful addition to SDCERS and exhibits our core values. Therefore, we be a man down, again, a vacant position in the call center, and Michelle will be missed. Lastly, we're in our last phase of testing workflow improvements, updating our IRIS retirement applications and member services portal retirement applications for the functionality, as mentioned in the action plan, member services benefit process best practices. This project for member services has taken years of development and months of testing and verifying in the system. This update involved the IT, benefits administration, finance, and member services working together as a team, because it takes each division to set up and pay out benefits to our members. Please let me know if you have any questions. Thank you. Go ahead.
Thank you very much. On the call center, what percentage of the calls are related to employee or retiree health? I mean, ballpark.
Ballpark, probably 50%.
Okay, sorry.
If I could jump in, it's also cyclical, depending on what is going on with the retiree healthcare program, whether it's open enrollment or changes in Medicare. It would look like a big, very high busy, lower, very high busy, lower as we go through the year.
So presumably, if the city ever actually does take this over, and apparently they will, that should improve your call times in a big way, because there'll be less of a drag from that, I take it.
I believe so, yes.
Thank you.
I just wanted to make a comment. We've heard great things over the past few months with Sarema, and I've just heard from some colleagues at the city that she's been doing a great job helping with the retirement counseling and getting this person to retirement. So thank you to her.
Oh, yes, she's very wonderful, and we really appreciate her. Thank you.
Thank you very much.
Thank
It
you.
was a good report.
Thank you.
Benefits Administration, Sandra.
Good morning. Just a quick update on Prop B. That May 14th funding deadline for the Prop B Phase 3 people is quickly approaching. To date, we've received full funding for 186 out of the 239 members joining the system. My staff report says 236, but 3 snuck in on me. I don't know how I missed them, but there they are, 239 total. We've been working with the city on ways to efficiently get all of these members into our system, and we're planning to use the city's employer transmittal process to bring them over and get them in the system. And then we will be scripting in their service purchases with our regular June software pension update. And speaking of employer transmittal processes, we received our first transmittal from the port that includes the new General 2024 employees. That was quite a process to get that plan implemented into the system on such a short time frame. And I really want to acknowledge all the work from staff in benefits administration, member services, IT, finance. Everybody really pulled together, contributed to making that a successful implementation. And we're ready to do it again if the board votes tomorrow to approve the new port plan. And after it goes through the legislature, we're experts at administering and implementing new port plans, so we're ready to do that. And lastly, I am happy to announce that the City Council approved a contract with Benefit Outsourcing Solutions, I think we're calling them BOSS, for the administration of city retiree health benefits. That contract does require a second reading at council in early June, but we have already scheduled an implementation meeting for next week to talk about the transition, hoping to kind of gather what the member data will be that we need to transmit to them, and then kind of forming a communication plan to successfully move through that transition. Any questions on my BA report?
Well, that's great news,
Yes.
isn't it?
Yeah, a
That's
long
good
time
news,
coming.
Right.
Since I'm here, I'll talk about the over 10,000.
Let me just ask you a question on
Sure.
that one. I never asked you this question, Sandra. How many people are being moved over in that case? I mean, roughly retirees, do you know? In other words, from us administering those health benefits to the city's contractor doing that?
Yeah, we have about 3,000 retirees enrolled in the sponsored plans, and then another 5,000 getting Medicare reimbursements and 2,000 plus getting retiree health care reimbursements for their premiums. Those are current numbers. It fluctuates as retirees submit for reimbursement, enroll in plans, new retirees come in.
So part of this goes away over time, right? Because some of these people, like me, have a particular benefit of having their health insurance reimbursed, but then the city phased out of that, and so that won't exist anymore over time, right?
In some ways it will, so the reimbursement piece is likely to get smaller, but everyone who gets a pension payment from SDCERS is eligible to enroll in a city-sponsored plan.
Okay.
So it's really the two pieces.
Okay. Thank you.
You'll see on the over 10,000 report that we did have one new overpayment that is related to late notification of a retiree death, and that has actually gone over to the legal division for collections on that. And then the 3 outstanding underpayment matters that you usually used to see at the bottom of your report. We have sent out reminder letters to those members that we have annual interest that's going to be added to their accounts again. Those letters went out in April. And we'll report if those matter, if and when and if those matters are resolved, then we'll report fully on those.
Is this the first time we're seeing that removal?
Yeah, they've just been on there for year after year, and it was one of the things I asked Greg about. The board rules do say that we'll report back to the board when these matters have been resolved or there's been significant change in them. So just kind of adding them to the end of the report didn't.
So we do an annual report where we list
Okay.
the overpayments and underpayments. And then the board has asked us to do is that when something new comes up, or if we've changed something or something happens, please let us know about it. And so we're just following the board policy.
So there's currently only 4, the 3 that we don't see plus the 1 that got moved to legal?
That are over 10,000, correct, yep.
Okay, thank you.
Thank you.
Personally would prefer that you leave it in the way you did it before, just so that we have a continual reminder of what's out there.
Duly noted.
Thank you.
Thank you. Information technology. Michelle.
Good morning again. A lot happening in IT right now, so I'll highlight a few of our significant updates. Earlier this year, we hired Security Pursuit to conduct our annual network penetration testing. This year, we expanded the scope of that service to include credential scanning and vulnerability scanning of our external applications. This service is currently being done by another security vendor on a regular weekly basis, but this was a way for us to vet them out to see if our results are coming out and they have comparable level of scrutiny on those security testing. The other added scope is social engineering, and this one has been pretty fun to do. So there's multiple aspects to the social engineering. We did phishing, email phishing. We did SMS phishing, which they call smishing, and we did pretext calling. So I'm happy to report this is hot off the press of the results of that social engineering. For the email phishing, we had a 98% pass rate. Based on our vendors' feedback, companies that do not have a good training program usually have a 10 to 14% failure rate. So the fact that we had only 2% is fantastic, and is noted that our staff is really diligent on reviewing emails. The smishing, which is the SMS texting, we had a 100% pass rate. Nobody was fooled by that message that they received to try to gain credential information. And the third is the pretext. So our vendor called our call center and various staff to try to gain information that they could potentially compromise either member data or security within our system. Those results are not in, but I can say that one of the call center members came and told me and reported it, which is the first line of defense, that they had an unusual call. So we're looking forward to seeing those results. Related to the remaining vulnerability scans of the network, Sean Kilpack is working with the vendor on remediation of their findings. You're going to receive a full report in closed session in July of their testing process, the results, and then our status of remediation. Since November of last year, IT has been working with the internal auditor and CBIZ to do an audit of the IT service delivery program. We recently received that final report, and there were only 4 recommendations, 3 of them related to IT. Of those 3, 1 is already addressed in our strategic plan, and 2 are recommendations to improve the security policies, and those are in process. Last but not least, Norma Frank has been leading the project to upgrade the on-base solution, which is what supports these board meetings and the creation of the agenda, the live streaming, and the minutes. This upgrade won't have much impact to end users, but it's critical to get up to the current version and also to support infrastructure updates for desktop operating systems and server operating systems. So that finish line is near. We're expecting to do production cutover following the meetings tomorrow. So our staff will be working over the weekend. Happy Mother's Day, Norma, to make that transition smooth. And I'd always like to close by thanking our IT staff and contractors for their dedication to keeping this program going and for our successes in our projects. So with that, I'd like to conclude and happy to answer any questions.
Thank you.
Yeah, I'd like to speak on the phishing, the email. Of the 2%, were any of those board members?
This was the first year that we've actually included trustees in our email phishing. So in the past, they've been kind of filtered out. There were 2 people who fell for the bait, and those people have been notified. And yes, one was a board member. Yes, and I think it's critical to know, as leaders on our executive team and board, your information is public. It's on our website. Your roles are identified. You become targets of our organization. So as leaders, as board members, as committee members, you become targets. They understand what information you have and how they can gain, what authorities you have to make decisions. So we did include you in this round of phishing. I'm happy to say I did get a message from one board member that says, "This looks suspicious. Should I click on it?" And I was like, "You passed the test."
That was me.
Yeah, I tend not to read all my emails throughout the 2 months that we're not here, but I did receive that last week, sent it to Sean, and he did confirm it was a phishing email. How is the 365 project going? Is that started yet, or?
So 365 is planned on the next fiscal year. So right now, we're working on developing the RFP. We plan to get an integration vendor engaged to help support us create that infrastructure before we start migrating services over. It's a rather complex project once you get into an enterprise solution. We want to make sure that we start it on the right foot and get the environment set up securely and efficiently. So you'll hear more about that likely in July and September.
Thank you. Good report.
Thank you, Bobby.
So, any comments from our chair, from the board, or Greg?
Oh, yes. As I mentioned to the Disability Committee, I just really would like to thank Elvin for his service. It has been a real pleasure to have you as part of our leadership team with your inquisitive nature, your very approachable personality, and your thoughts and business acumen. It's just been a real pleasure having you on the committees and on the board, and I would hope someday that our paths will cross again and that you'll continue your SDCERS board service. Thank you, Elvin.
So moving on to closed session. Johnny, do we have any items to discuss?
We don't, Bobby, thank you.
All right. Thank you, Johnny. So that concludes our Business and Governance Committee meeting, and the time is 11:30. So we'll see everybody tomorrow.
Thank you.
Quicker than disability for the first time ever.